the possible extension of the mask mandate. Second, we will have our third work session to discuss the county executive's proposal to require a vaccine mandate to enter certain businesses. Our last work session was very helpful and productive, and we heard from a number of key stakeholders who will be the most directly charged with enacting such an order about their concerns about the one-size-fits-all approach, their concerns about the ability to actually enforce this because of the current situation on the ground with staffing levels, and also concerns raised about the feasibility of Montgomery County Police, who is in the order charged with addressing this if it rises to a civil unrest situation in which someone outright refuses to actually confer with the mandate. And there's concerns raised about the current status of Montgomery County Police and all that is already on their plate and adding another layer to it. So I don't believe the council will be voting on this tomorrow. I think that my colleagues and I in particular still have many questions that have not been answered, especially with regards to the overall goals of this initiative and whether or not this is the right tool at this moment, given our high vaccination rates, but also given the very real issue of spread through Omicron that is going through breakthrough cases in which people are vaccinated. So we're not confident that this is the right tool at this moment, and we still have a number of questions, but we will have another work session on the mandate tomorrow. And then finally, I'll mention just the county executive released his recommended capital improvement program budget last week. The council will be digging into it over the next several weeks. Work sessions will begin shortly in tow. This is a CIP year, and so it's not just amendments or changes to the CIP, but this is a multi-billion-dollar document that we will be working through as well. So with that, and in the interest of time, I yield to my colleague, Council Vice President Glass, to make some comments, and then I will yield to Mr. O'Donnell to briefly give an overview of the status of where we are with COVID and operations right now. Council Vice President Glass.
Well, thank you very much, President Albornoz, and I just want to echo the sentiment you expressed at the top of this discussion with the situation in Magruder, that our hearts go out to that community, the MCPS community, and thank everybody who arrived swiftly to make sure that the situation was under control. And I know that there will be more conversations in the press conference later today by MCPS and MCPD. I just want to pick up real briefly on what you were just talking about regarding the CIP, and that the council will in fact be taking up the multi-billion-dollar budget that has been introduced to us, but there are a number of really important and forward-moving buckets and areas for us to look into, mostly from my perspective, looking at roads, at Vision Zero, and at climate change. There's a lot in there to improve the transportation mobility in our community and also mitigate for climate. And I will use that as an opportunity to share with all of you that later this afternoon at the Transportation and Environment Committee, there are going to be two conversations that I think are really important given where we are right now. One is a conversation about climate mitigation here in Montgomery County. Last year, I commissioned a report from our Office of Legislative Oversight to look at how Montgomery County is doing as we prepare for climate change, as we experience climate change. And the headline there is that we already have more flooding than we have ever had historically, and that we need to prepare for more. And so we need to look underneath the ground at our sewers and pipes and infrastructure to figure out how to stem that and mitigate any future flooding situations. One quick data point is that before the year 2010, Montgomery County would experience 2 to 4 occurrences of flooding a year. And after 2010, we experience an average of 39, and that is undeniably climate change. So we need to figure that out. And the second item on the committee agenda is a bill that I introduced regarding snow shoveling in our equity emphasis areas. Recognizing that we've had about 6 inches of snow over the last 2 weeks. This is a bill I introduced last year, And the equity emphasis areas are classified by the Council of Governments as areas that have a concentration of low-income minority populations or both. And they are much more pedestrian in their nature of commuting. They are much more reliant on public transportation, and we need to make sure that they're able to get to their bus stops, to the metro, and walk around their neighborhood. And so these are two conversations that'll be coming up at 1:30 at TNE. And with that, I yield back to you, Council President.
Thank you, Council Vice President Glass. Just logistically for our colleagues in the media, we do have a hard stop at 11:30 because we have a state legislative session that begins then. So Mr. O'Donnell, 12:30, sorry, 12:30. Thank you. Mr. O'Donnell, if you could just give a brief overview of current matters with regards to COVID so we can get to Q&A, that'd be great. And just a reminder to all, we have an extended Board of Health session tomorrow morning. We'll receive the full version of this report.
I'm happy to. So just going through where we are with our most recent numbers, we have seen a fairly steady decline over the last week and a half now. Our positivity rate is currently at approximately 11%. This is likely being influenced by a large number of rapid tests that are also occurring that are likely not being reported. Looking at our transmission rate, we're now at 771 per 100,000 over a 7-day period. And our acute care bed utilization is continuing to decline, which is extremely good news. It's still at a fairly high rate, and our ICU beds are still at one of the higher rates that we've experienced during this COVID response. So we are still looking for that to come down. Our vaccination totals just continue to slightly tick upwards with increasing number of 5 to 11-year-olds coming out, and we are getting some slight movement with other age groups who have not been vaccinated yet. But the true story is getting a significant number of people out for boosters. There's still that remains the busiest amount of vaccinations the county is doing, but there's still an enormous group of people who are eligible for the boosters. Getting that booster is the best protection against the Omicron variant. And we strongly, strongly recommend that. And then just finally to give an update on the county's efforts to distribute both rapid tests and now masks. We have gone through 2 weeks of distributions of rapid tests at our libraries and have distributed more than 419,000 rapid tests through that measure. Beginning on Friday and Saturday, we also began distributing masks through those sites. I know we'll be sending more masks out to all of the sites this week, and we'll continue pushing that out, not only through our libraries, but we are also doing distributions. We've had pickup distributions for the registered licensed childcare facilities, and we'll begin doing it with our private schools as well this week. So we've been distributing masks out as well as these rapid test kits. Currently, the masks that we have are predominantly adult sized. We just sharing that information. We are trying to procure child-sized masks as well, but those have always been a difficult thing in the KN95 or the N95 model because historically they've been developed for adults who work in medical healthcare. So there has not been a historical large production of that, but we are trying to reach out to our state partners to see if we can get some through them or through other mechanisms. So that's all the updates I have for right now, and happy to yield more time for questions.
Great, thank you so much, Mr. O'Donnell. Do you mind stop sharing your, oh, there we go. Great, thank you so much. So the first question this afternoon, I just want to let everybody know that we do have a hard stop at 12:30. Just
okay, we've heard.
Also, too, our first question this afternoon is Tom Fitzgerald with Fox 5. Tom.
Good morning. I'll give you two questions on the virus. One on the vaccine mandate and the other on masks. Your numbers on vaccination, you don't have a lot of ceiling there. That's, you've done really well. one thing we've learned through this is that timing is everything. We had a briefing with the governor last night. The statewide numbers are coming down significantly. Year-old numbers are looking better. What do you view as success in this right now? And being as how we seem to have gone past the peak now, have we also gone past the point where this mandate would be necessary? Also on masking, I know you've got end of February that you're looking at for maybe this to expire. Give people an idea what you would need to see for that to happen, or are they just in an environment now where they're going to be looking at endless masking? And those will be my two questions. I'll end there.
Thanks, Tom. I'll start with the last one first. This council has provided a specific end date so that we don't signal to the public that masks are going to be here indefinitely or certainly forever. The benchmarks that we are looking at in consultation with our public health team include community spread, hospitalization rates, vaccination rates, a combination of all of those. But it is clear, as you noted, and as Mr. O'Donnell stated, that the numbers are going down. And as was predicted based on what has happened in other parts of the world, Omicron is going to leave as quickly as it came. That's the good news. The operational impact remains, and the residual impact of that is significant because we're hemorrhaging really great people at important frontline positions such as nursing, teachers, substitute teachers. People are exhausted, and this is added to that. So the ramifications of that are yet to be determined, but the virus itself appears to be exiting, which is good news. And with regards to your first question regarding the mandate, I do think that given the high ceiling, as you noted, that it does call into question its efficacy right now, because if the goal is to increase vaccination rates, they can't get much higher than they are. And so that's one of the reasons why the council, at least at this time, the majority of my colleagues are not confident that this is a tool that's necessary right now, because the spread is beginning to diminish. And even at its highest point, it was occurring within breakthrough cases. And so a vaccination card wouldn't have provided a great deal of resistance against it anyways. So that's why we're not likely going to move this forward tomorrow.
Thank you, Tom. Our next question this afternoon comes from Jacqueline Quijano from Univision. She has a question for President Albornoz in Spanish.
Yes, hello, my name is Jacqueline Quijano from Univision. I have a question for President Albornoz. If you could please answer in Spanish. How are the rapid tests and mass distribution going at the county? Do you believe MCPS should establish a vaccine mandate for students? Es decir, presidente, si nos puede hablar sobre la distribución de mascarillas en las librerías y si creen como consejo que los estudiantes deberían de tener como mandato la vacunación. Además, si me podría hablar de las oportunidades de trabajo tanto en ride-on como en los buses escolares. Gracias.
Gracias, Jacqueline. Primero, la buena noticia es que el Departamento de Salud y Servicios Humanos ha trabajado con la comunidad a dar más de 1 millón de los exámenes rápidos en no solo bibliotecas, pero también con alianzas con diferentes organizaciones comunitarias. Así que eso está yendo muy bien y recibimos un orden de 8 millones de exámenes rápidos que vamos a poder dar a la comunidad por los próximos 3 semanas. Y la buena noticia también es que hay mucha gente que están pidiendo estos exámenes rápidos. También nos está yendo bien en dar los mascarillas, los N95 mascarillas, porque esos son los mejores. Como explicó el señor O'Donnell, necesitamos más para jóvenes, pero hay suficiente para adultos en este momento y vamos a seguir dando esas mascarillas porque es sumamente importante. Perdón, Jacqueline, ¿cuáles eran las 2 otras preguntas?
La otra pregunta sería encaminada, a la oportunidad de trabajo que están en los buses escolares y también si creen como consejo de que las escuelas deberían de tener como mandato las vacunaciones. Gracias.
Claro. El mandato de vacunaciones es una decisión que se hace a nivel del Estado. y es importante que nosotros damos honor de ese sistema y que ellos hacen las decisiones porque saben más que el consejo sobre cuáles son las dificultades en operaciones y cuáles son las oportunidades. Así que el consejo respecta el proceso que usa el Estado en hacer esa determinación. Respecto a los conductores de buses, esa situación sí ha mejorado, pero sigue siendo un problema bien difícil. Pero hemos recibido un mensaje al nivel del Estado que no vamos no nos van a dar ayuda con eso específicamente, que el condado a sí mismo va a tener que encontrar conductores de bus. Pero las cosas están mejorando, los casos están bajando, así que eso es la buena noticia ahí.
Thank you, Jacqueline. We have another question. The next question comes from Daniel Rivera with Telemundo. He sent us a direct message. Daniel?
Good morning. This question is for President Albornoz. If you can answer in Spanish, thank you so much. Presidente, buenos días. La situación que ocurrió el pasado viernes en la escuela Magruder obviamente pues ha levantado mucha preocupación entre padres por el hecho de estas armas fantasmas. Usted entiendo que sometió legislación no hace mucho y quisiéramos saber en qué estado está y también por qué se está dando este incremento, este acceso tan fácil entre la juventud, estudiantes en este caso, de armas fantasmas.
Gracias por esa pregunta, Daniel. Armas fantasmas es un problema bien grave, no solo aquí dentro de nuestro condado, pero sino en el país entero. Estos productos se pueden comprar por el internet. No hay ningún chequeo para comprarlos y sabemos que estas armas son sumamente peligrosos. Son hechos de plástico, son muy fáciles de armar. Y hay muchos jóvenes, están cayendo en las manos de muchos jóvenes, que es un problema bien grave. El condado pasó legislación el año pasado para prevenir la venta de estos productos aquí dentro del condado, pero en este momento está en los cortes porque hay un grupo que está luchando contra el condado y legislación que pasamos el año pasado. Así que es sumamente importante que esa legislación pase al nivel del Estado, que tiene más poder que locales y municipales en temas de legislación de armas. Pero también necesitamos ayuda del gobierno federal, porque aunque pasamos aquí algo en el Estado, eso no pare una persona de ir a Virginia o Pennsylvania o otras partes de los Estados Unidos donde no tienen esas leyes para comprar los productos ahí y traerlos aquí dentro de nuestra comunidad. Así que necesitamos trabajar todo junto aquí, el gobierno federal con el Estado, con el condado, juntos.
Y también en las escuelas directamente, ¿qué se está proponiendo, no? Porque expertos en seguridad también dicen que es muy importante esta relación de estudiantes con los recursos de seguridad oficiales que hay en las escuelas para tratar de alguna manera si alguien conoce de algún otro estudiante esté portando un tipo de armas como esta, pues obviamente, ¿cómo se va a fortalecer eso en las escuelas?
Bueno, todo tiene que estar en la mesa. Tenemos que hacer una evaluación sobre la seguridad que tenemos dentro de los colegios en este momento, especialmente con lo que está pasando en este momento. Y vamos a ver cuáles recomendaciones hace el sistema escolar trabajando con nuestro departamento de policía y el departamento de salud y servicios humanos. Y estamos listos para apoyarles en esas recomendaciones.
Thank you so much. Gracias.
Thank you, Daniel. Our next question comes from Rebecca Tan from the Washington Post. Rebecca.
Thank you. Thank you for having me. Council President Gabe Albornoz, you said that the council's probably not going to vote on the vaccine mandate, the vaccine passport tomorrow, but can you say when it's scheduled, when it's probably going to vote on the proposal?
We don't have a specific date, Rebecca. I think that there are still many more questions than answers. And I think there's also an interest in waiting to see how the District of Columbia's policy has been enacted. So the council is certainly not ready to vote on this right now. I can't project at the moment when we would be able to, or if we would be able to at all, quite candidly. We do want to wait and see how things roll out in the district and have that serve as a guide for us as well. Now, we will wait to see what the deliberation and discussion leads us tomorrow, but at the moment, that's the sentiment I'm feeling among the majority of my colleagues.
Got it. You also mentioned, some of the repercussions of Omicron, even as it starts to retreat. One of them has been the staffing shortages, right, that you mentioned, and we're seeing that really acutely across the healthcare industry, whether it's at nursing homes or hospitals. I'm curious if you can speak a little bit more to what the council has been doing to address or support support the industry that's facing these really crisis level staffing shortages at the moment.
Well, thanks for that, Rebecca. And I really want to give a credit to you and your colleagues who've been doing some really good reporting around this and highlighting the emergency that we're in. This is, as you said, absolutely correctly, is going to have a long-standing impact for quite the foreseeable future. The council's done several things. The first is we have appropriated additional resources and funds to nonprofit organizations who are on the front lines, particularly serving our more vulnerable populations. We have done this for our community that serves the community for people with disabilities. We've also expanded support for organizations that support our aging community, which, as we know, has been disproportionately impacted. And as was noted in some good reporting this weekend, remains the fastest growing demographic across this country. And so at a time where we're seeing a stark rise in the population of people who are going to need support services, we're seeing those support services diminish because we don't have the staff to support them. That's a huge issue. But one is in the development, and we've appropriated more resources and will appropriate more as necessary to triage the current situation that we're in right now. Second, we need to work with Workforce Montgomery to take a long view in recruitment of people into this field. We have been supporting both Montgomery College and the universities of Shady Grove in their nursing program, of one of many examples that we are aggressively providing some additional resources to, but just generally providing support of, because we need to recruit and train individuals as quickly as possible to be able to come on board. But the third area that we're going to need to focus on is the area of just general mental health and burnout. And that's going to take a collective partnership between not just the government, but also our public and private and nonprofit sectors, working to see what we can do to provide more direct support from a mental health standpoint to the existing staff that's there now. And if we can, diminish some of the burnout that we're seeing. All of that is going to take time and resources, but that's just at least some of what the council's done and is committed to doing.
Thank you, Rebecca.
Thanks.
Thank you. Just another friendly reminder, everybody, we have a hard stop at 12:25, okay? Our next question comes from Sierra Fox with Fox 5 DC with the questions for Council President as well. Sierra?
Thanks, Jordan. Good afternoon, Council President. Given the rise in violence at schools and the shooting that happened on Friday at Magruder High School, do you believe it warrants a conversation of bringing back SROs? Why or why not?
Thank you, Sierra. Yes, I believe it warrants a conversation about all security measures, including whether or not we should be bringing back or in some form or fashion the school resource officer program that was phased out for this new system that we are in right now. Just as we are providing additional support to our faith-based organizations at the moment because of the situation that's on the ground, what happened in Texas, the credible threats that we are starting to see across the country, we have to recognize the reality that's on the ground. There is nothing more important than the safety and security of our children and youth, and of course, the faculty and staff at these schools. And the proliferation of weapons, which has been noted and is terrifying, and the ongoing mental health challenges that are rising to a clinical level in a significant number of cases, warrants us evaluating everything and all aspects of this.
The plan was to take money previously for SROs to go to mental health support. Have any of those positions been filled yet, or can you talk about what you all are doing right now?
Sure. So some of the positions, and it was in addition to, it wasn't to utilize the school resource officer funds and put them in a different direction. It was both to increase the budget of our school system, but those SRO officers have been redetailed within Montgomery County Police, and so they remain working just in a different capacity. So the budget wasn't really reduced; it was uplifted through our school system to address those mental health issues. I asked that same question over the weekend, and we'll be getting a response soon in terms of where we are on hiring the 50 social workers in this upcoming school year. We're also, I know, looking through the Department of Health and Human Services at enhancing the support services we're providing through our school health and wellness programs, but also our street outreach network, our nonprofit organizations that are on the ground, linkages to learning, all of that right now is being evaluated to see what can be enhanced. And I should also note, our school health nurse program is also something that we have to look at too. We had a deficiency prior to the pandemic in the number of school health nurses, which are often on the front lines in addressing some of these complex needs. And we have to provide greater support for them as well.
One more quick question. Tú eres Latino, and I know on Friday there may have been some communication mishaps or lack thereof. Are you in touch with Montgomery County Public Schools at all? I know mothers and fathers, for example, who only speak Spanish, they were trying to get me to translate for them because they had no idea what was going on.
Yeah, I appreciate you bringing that up, Sierra. You're right. That is something that has to be evaluated because we have to be able to effectively communicate in real time, period, but with everyone. And so I know that's part of the evaluation that's going on right now in terms of what worked and what didn't work. And I know that's a big part of the discussion that has to be tightened up. All of it has to be tightened up. Let's pray that this never happens again, but we'd be naive to think that it won't. And so we have to be prepared, and that's a big part of that preparation.
Thank you.
Thank you, Sierra. Our next question this afternoon comes from Steve Bonnell with Bethesda Beat. Steve?
Hello, everybody. I think Sean's probably best positioned to answer this, but looking at kind of the new proposed kind of guidelines for when the mask mandate would lift, can you just go into kind of how the health team kind of put in these three provisions, and then also the end date? And then the last question I have is, since it's a kind of a 7-day off ramp for these metrics kind of on the decline, does that clock start when and if the regulation is passed, or can it be retroactive, I guess?
Steve, I think some of those details will probably be resolved with how the council puts together the recommendation for this. So I don't have those details currently, but we are, of course, all those factors the council president shared are things that we're going to be considering. And, I think we're talking about largely the mask mandates for public indoor settings. And I know we may take the masking use in other facilities, just to bring this up, in other facilities as a separate issue as we ramp down with those public facilities, because obviously we treat other congregate settings a little bit differently. But we're happy to provide some guidance to our elected officials on this. But as to whether it will be retroactive or the number of days, I think that will come in the developed guidance from the council.
Can you just give the public any sense on why that date was picked, I guess? The February 28th date, or if I'm wrong, correct me, but.
At the moment, I'm not sure why the specific date was put in place. I know when this was last brought up, there was a lot of concern about the changing increase in our positivity as well as our cases. But again, that's something that could be reevaluated as we go forward.
Thank you, Steve. We have to move on. Thank you so much. Our next question, we have 2 more minutes left, guys. Heather Curtis with WMAL. Heather? Hey, Heather, are you here with us? Okay, we'll go on to Kate Ryan, and Heather, if you come on in, we'll let you ask your question.
I
Hi,
got it.
Thank
Sorry
you.
about that.
Hi, Heather.
Okay.
Sure. So, Council President Albornoz, if I translated what you said to Jacqueline correctly, you said the state will not be giving help to alleviate the bus driver shortage. I'm wondering if that means they've denied the request to have members of the National Guard come in and drive buses.
My understanding is that the response back was the members of the National Guard have already been deployed to our hospitals and that they were not in a position to be able to be further deployed as bus drivers.
Thank you so much.
Thank you, Kate. Thank you, Heather. Our next question comes from Kate Ryan with WTOP.
And I'll keep it fast. I know you've been watching the clock there. I can see that. Very quickly on the SROs, if you were to take a vote on this, what would that vote be? Have you talked to your fellow council members? And very quickly, in order to bring them back into the schools, would you have to rewrite an MOU?
Thanks, Kate. So there were, for context, as everyone may recall, two competing bills last year. One that would, in legislation, formally remove the officers, and the other, formally in legislation, would retain them. And what the decision was made at the time was that the school system should be given the opportunity to make those decisions because they are the most directly impacted and involved and familiar with the operation that's happening on the ground and are in the best position to connect with parents, faculty, staff, students themselves, partner with the Department of Health and Human Services and Montgomery County Police to determine what's possible and feasible, and rather than have that be legislated. I felt then that that was appropriate, and I feel now that it's appropriate to let the professionals who have been appointed or directed and have a lot of experience and are more familiar with what's happening on the ground to be making these decisions. Now, the council obviously has an important role to play in its oversight capacity, but also in its support of those decision makers. So I don't know where my colleagues would be right now if this came back to us for consideration under legislation. I do know that we are very much monitoring what's happening, and we will be working closely with all of the key stakeholders here as the situation develops, and are open to recommendations that they make.
Bottom line, who has the ultimate say on whether or not we see SROs back in schools?
In the short term, that decision will be made with the county executive in partnership with the superintendent and our Board of Education, with consultation of all the key stakeholders in the short term.
Thank you. Thank you, Jordan.
No problem. Thank you, Kate. Council President Albornoz, we do have two more questions. Do we have time to quickly answer them, or should we?
Yeah, let's try to answer them, and then we'll cut it off right at 12:30 and turn it over to the state legislative session.
Thank you so much. Our next question comes from Nordia Lewis with WDVM. Nordia?
Hi, thank you. So I know you don't have plans yet to vote on the vaccine mandate, but if you do vote on it, do you have plans on how you are going to help local businesses who have to turn away some of their business, evidently?
Good question. And I think that if it is ever voted on, that, at least speaking for myself, would need to be part of the plan. There would need to be support in some form or fashion, because if we are setting up businesses to not be able to enact this, then we defeat the purpose of enacting it in the first place. But that would be my provision.
Okay, thank you.
Thank you so much. Our last question is from Dominique Maria Benessi with WAMU. Dominique?
Thank you so much, Jordan. I switched my question. I thought it was going to be for Mr. O'Donnell, but he answered that question with Steve. Councilmember Albornoz, regarding the vaccine mandate, now it being off the table, but again, there's this consideration for businesses. Is there any chance, how long do you think this delay will be? I mean, is it just because your work session more on it, or sort of when will we see this bill be brought up again, I guess?
I don't have a definitive answer for you. I think we want to be cautious and methodical. So I don't want to set some arbitrary date for us bringing it back up. We're going to let the situation on the ground dictate what's happening. And because the numbers are receding as quickly as they are, and because of the legitimate concerns raised by the small businesses who would be charged with enacting this, That's the reason we're pausing this at the moment. If there's a new variant, if the new situation arises, as has been the case since the beginning of the pandemic, we'll evaluate and assess and make adjustments as necessary, but we just don't think there's enough information to be able to act on this right now.
And you'll be giving businesses a week or so notice prior to a vax mandate going into place? Because I know the bill itself, when it was written, said, you know, literally the Friday right after the hearing, it was gonna be in place.
Yeah, if it does ever move forward, clearly we would need to provide a reasonable threshold for businesses to be able to enact it and onboard it in a way that's appropriate. And that would remain the case, as it has with the mask mandate and some of the other provisions we've had to move forward, you know, in an attempt to try and keep us all safe. And so we would want to make sure there was a long enough runway for businesses to be able to enact this.
Thank you, Dominique. Thank you so much. We're at 12:30. Council President, I'm going to go ahead and toss it back to you to close this out.
Great. Thanks, everybody. Obviously, there has been a lot going on, and there will likely be more this week. So we look forward to seeing you all. And as is always the case, please don't hesitate, as I know none of you do, to reach out to us with individual questions in between our media briefings with all of you. Thank you all so much. And just in real time, I'm hearing through the grapevine that the press conference has been moved to 4:30 today, and will be done in front of police headquarters. I don't know whether that's confirmed, but I wanted everybody to know that. Thank you all so much.
Thank you.